What if the biggest threat to something you love was tiny, hidden, and could stay dormant for years, only to emerge en masse when you least expect it? Today, we're taking a deep dive into exactly that kind of silent menace, Cyathostominosis. You probably know them better as small Strongyles or small red worms. And this is a major, really growing challenge for horse owners and vets everywhere.
It really is. And despite their size, I mean, they're incredibly small. Adults are only, 6 to 20 millimeters long. But they're considered the most prevalent, the most significant equine intestinal parasite out there.
So small, yet so significant.
Exactly. And what makes them such a headache, and frankly pretty terrifying, is how common they're becoming, the widespread resistance to deworming drugs, and, the real difficulty in actually preventing and treating that hidden stage, the larval stage. It's like a biological chess match.
A chess match, I like that. So our mission today is to kind of pull back the curtain on their complex life cycle, right? We want to reveal why they're such a serious threat and give you some insights into the modern ways we diagnose, treat, and importantly, prevent them. We're going to get into the fascinating and honestly kind of horrifying biological mechanisms at play, give you the real shortcut to understanding this quiet invader.
Okay, so to start, it's good to know we're not just talking about one worm here, Cyathostomins. There are actually over 50 different species of these small, strong eels.
50? Wow.
And their life cycle is what we call direct. That just means they don't need another animal, an intermediate host, to complete it. And that simplicity, well, that's what lets them spread so effectively.
Okay, so walk us through it. How does this whole cycle kick off? I'm guessing it starts with the adults already inside the horse.
You got it. The adult Cyathostomins, they mostly live in the horse's colon and cecum, that's the large intestine. And there, they produce just a huge number of eggs. These eggs then pass out in the horse's manure onto the pasture.
Right, onto the grass.
Onto the grass, and out there, those eggs hatch. They develop through a couple of early stages, L1 and L2, and then they reach the infective stage, which is L3.
And these L3s, these are the ones the horses pick up when they're grazing.
That's the one. And here's where they get really clever and a bit alarming. These L3 larvae get this protective sheath. Think of it like a tiny invisible raincoat.
Okay.
And this sheath lets them survive out on the pasture for a long time, even through freezing conditions. Now, hot, dry weather does knock their numbers back, but they're surprisingly tough. So once a horse eats these sheathed L3s while grazing, the larvae then penetrate the lining, the mucosa and submucosa of the cecum and colon. They burrow in.
Okay, this sounds like their secret weapon.
Yeah.
This insisted stage, right, hypobiosis. What actually happens then? Do they just sit tight? Is this the dangerous part?
This is absolutely where the hidden danger really lies. Now, a small number of these L3s will develop right away, but, and this is the key part, a really significant number, it could be up to 90%. In some horses, they go into this prolonged period of, suspended animation, inhibited development.
90%.
Up to 90%. They become these encysted early L3 larvae buried deep inside the intestinal wall. This hypobiosis lets them stay dormant, completely protected from what's going on outside, and critically protected from many dewormers for weeks, months, even up to 3 years.
3 years. That's incredible.
It is. And there's a seasonal aspect, too. In temperate places, like here, this usually happens over winter. In tropical climates, it might be during the hot, dry summer.
So they're like these tiny ticking time bombs inside the gut wall, just waiting. Waiting for what, though? And when they do go off, what happens?
Well, that's when you get the most severe, often life-threatening disease. It's called acute larval Cyathostominosis, or sometimes parasitic colitis. It's triggered when massive numbers, literally millions sometimes, of these encysted larvae suddenly decide, okay, time to emerge. They come out as L4 larvae. This tends to happen in the fall, winter, or early spring in temperate zones, often catching everyone completely by surprise.
Millions erupting all at once. Inside the horse, that sounds like a biological catastrophe. What kind of damage does that sudden emergence do?
It causes severe inflammation. We call it colitis and typhlitis inflammation of the colon and the cecum. Just imagine the gut lining suddenly becoming incredibly irritated, damaged, everywhere. This leads to this massive leakage of water, electrolytes, and really vital proteins right out of the bloodstream and into the intestine.
So that's where the protein loss comes in.
Exactly, hypoproteinemia. And that loss causes significant swelling or edema. You often see it on the lower belly, the chest, down the legs. Plus, the horse's system starts absorbing harmful endotoxins because the gut barrier is compromised. This whole cascade can lead to severe colic, shock, and tragically often death. It's really, really serious.
So that's the acute, terrifying, life-threatening version.
Yeah.
But what about the adult worms, the ones just living in the gut, not encysted?
Mm.
Are they causing trouble too?
Yeah, they definitely can. The luminal adult worms, while not causing that acute crisis, can still lead to problems. They can cause something called catarrhal colitis, a milder inflammation. This often shows up as lethargy, weight loss, maybe some chronic diarrhea. You see this more in younger horses or those with really heavy worm burdens who haven't built up much immunity yet. And beyond that, yeah, a high number of adults can contribute to non-specific colic, sometimes intestinal infarction where blood supply gets cut off. Granulomatous colitis, which is a specific type of inflammation, cecal tympany, that's gas buildup, and even intussusceptions, where the gut telescopes in on itself. So, yeah, they're not harmless.
Yeah, okay, so this is clearly a serious threat all around. What does this mean for someone looking after horses? What are the really critical signs to watch for, especially for that severe larval form?
For the acute larval Cyathostominosis, you are looking at a genuine emergency. The signs are often sudden and they're profound. A real hallmark sign is that sudden, profuse, watery diarrhea, just pouring out.
Yeah.
That's often coupled with dramatic, rapid weight loss, emaciation, and just general weakness. You might also see a fever, colic, which can range from just mild discomfort to really severe pain, and that telltale swelling, the edema on the belly, chest, or legs because of all that protein loss.
That swelling sounds like a really key visual clue, doesn't it?
Oh, it absolutely is. It indicates something very serious is happening internally with protein levels. You'll also typically see horses go off their feed, anorexia, they become lethargic, depressed. Dehydration is common, and in the worst cases, you see signs of endotoxemia leading towards circulatory shock. And you really need to understand the prognosis here is extremely guarded. The fatality rate is high, like 30 to 50%, sometimes even higher, even with really intensive vet care.
That's incredibly sobering. And the signs for just a high burden of adult worms, more subtle.
Generally, yes, more like that ill-thrift picture. You know, the horse just isn't doing well. Poor coat, low energy, maybe losing condition slowly. Not that sudden dramatic crisis.
So who is most likely to suffer from this kind of severe parasitic attack? Are some horses more at risk?
Well, any horse can get infested, definitely. But younger horses, say, between 1 and 4 years old, and also geriatric horses, older ones, they tend to be more susceptible. Their immune systems are either still developing or maybe declining a bit. And that acute larval Cyathostominosis, the really bad one, that's definitely seen more often in those younger horses, under 5.
Okay. And what factors increase the risk generally?
Well, age, like we said, season plays a role. How long it's been since the last deworming is obviously a factor. And really importantly, high larval burdens on the pasture itself.
Right, and high pasture burdens. That usually points back to management, doesn't it?
Almost always, yes. It generally reflects that parasite control measures haven't been quite adequate. You know, things like too many horses on too little land, high stocking density, overgrazing pastures down to the dirt, using dewormers inappropriately, or maybe using ones that aren't effective anymore due to resistance. And a big one, not removing manure from the pastures regularly. All these things let those infective larvae build up in the environment.
Okay, this brings us to a really shocking point you touched on earlier. If we're trying to control them, what about deworming? Because here's where it gets incredibly weird, paradoxical even. You're saying the treatment itself, especially ones aimed at adult worms, can sometimes trigger the worst form of the disease. How on earth does that work?
It is a paradox, isn't it? And it's such a critical thing to understand. What we think happens is, well, the sudden removal of those adult worms from the gut lumen acts like a signal. It seems to tell those thousands or millions of encysted larvae hiding in the wall, hey, the coast is clear, time to come out.
Wow.
So instead of fixing the problem, the dewormer accidentally triggers this mass eruption of larvae from the gut wall. And that sudden eruption is what causes the severe acute disease.
So the very act of trying to help can unleash the hidden threat. That's chilling. Okay, so diagnosis is obviously critical, but if the main issue is these hidden larvae, how do vets actually figure it out? It sounds like just counting eggs in the manure won't work.
You're absolutely right. Diagnosing the larval form, larval Cyathostominosis, is really tricky, specifically because those fecal egg counts, the FECs, are often low, sometimes even 0.
0, even when the horse is critically ill.
Yes, because the severe disease is caused by the immature larvae burrowed in the gut wall. They aren't producing eggs yet. The adults in the lumen are the egg producers. So if you have a horse showing those severe sudden signs, the diarrhea, the weight loss, the edema, and the egg count comes back low, that should be a massive red flag for larval cyathostominosis.
So if the FEC isn't reliable here, what do vets look for? How do they piece this puzzle together?
It's really a combination of things. The clinical picture is huge, those typical severe signs we talked about, plus the horse's age, its history. That's all crucial. Then blood work is really informative. Key findings are often low blood protein hypoalbuminemia because it's all leaking into the gut.
Right, the edema clue.
Exactly. You might also see hyperglobulinemia, an increase in other blood proteins, increased acute phase proteins showing inflammation, neutrophilia, which is a high white blood cell count signaling infection, and maybe microcytic anemia, small red blood cells, often from chronic inflammation or blood loss.
Are there other specific tests, maybe imaging?
Yes, abdominal ultrasound can be really useful. It can actually show thickening and edema in the wall of the colon and cecum, basically, visual evidence of that swollen, inflamed gut. Sometimes taking a tiny tissue sample via a rectal mucosal biopsy and looking at it under a microscope, histology can identify larvae or the inflammation they cause. There's also an ELISA blood test that's becoming more available. It detects antibodies the horse produces against those encysted larvae, suggesting a hidden burden. And, sometimes you get confirmation just by seeing large numbers of the small red L4 and L5 larvae passing in the manure or finding them on the sleeve after a rectal exam.
Okay, so once it is diagnosed, what's the urgent treatment plan? You said it's a race against time, given that fatality rate.
It absolutely is. Acute larval cyatostominosis is a flat-out medical emergency. It needs immediate intensive veterinary care, usually hospitalization. The cornerstone of treatment is a larvicidal dewormer, one that kills the larva. Moxidectin, given orally at a specific dose, 0.4 milligkilograms, is generally the drug of choice. Why? Because it's effective against all the stages, including those difficult encysted larvae. But, and this is a big but you have to be incredibly careful with the dose calculation. Moxidectin can be toxic at just double the recommended dose, especially in horses that are already thin and debilitated.
Okay, so careful dosing is key. Are there other deworming options if moxidectin isn't suitable or if there's resistance?
Yes, there's another option. A power pack dose of fenbendazole. This involves giving a higher dose, 10 milligkilograms daily for 5 days straight. That regimen can also be larvicidal, however. This is really important. Resistance to fenbendazole is very, very common now, widespread. So ideally, you'd want to know if fenbendazole actually works on that particular farm through resistance testing before relying on it in a crisis. And critically, another common dewormer, ivermectin, while great for many adult worms, is generally less effective against those inhibited encysted larvae. So it's not the go-to for this acute emergency.
Got it. Moxidectin or maybe fenbendazole if it works there. What else is absolutely vital to give these incredibly sick horses a fighting chance? It can't just be the dewormer, right?
Absolutely not. Anti-inflammatory therapy is essential. Corticosteroids like prednisolone or dexamethasone are critical. They help reduce that severe gut inflammation caused by the larvae emerging, and studies show they significantly improve survival rates. NSAIDs, non-steroidal anti-inflammatories, are also used to manage pain and fever. And then, of course, there's massive supportive care. We're talking IV fluids, and lots of them, to combat dehydration and fix electrolyte imbalances. Plasma transfusions might be needed if the protein loss is really severe. Nutritional support is key. Anti-endotoxin therapies to counteract the toxins. And often antibiotics, too, to prevent secondary bacterial infections taking hold in that damaged gut. It's truly intensive care, a full court press, like you said.
That sounds incredibly intensive and expensive, which I guess reflects the severity. So zooming out, what does this all mean for the long haul? How can horse owners actually prevent this kind of devastation in the first place?
That's the million-dollar question, isn't it? And it really requires a big shift in thinking, a change in philosophy away from old habits. We absolutely need to move away from the traditional approach of just, deworming every horse every 8 weeks or whatever the schedule was. That blanket approach isn't sustainable. We need a veterinarian-guided, integrated, and importantly, targeted parasite control program.
Targeted, meaning not every horse gets treated the same.
Exactly. The key goals now are twofold. 1, reduce the number of infective larvae contaminating the pasture. 2, minimize the development of anthelmintic resistance, so the drugs we do have continue to work.
So no more just calendar-based deworming for everyone. How does this targeted approach work in practice?
It's centered around something called targeted selective treatment, or TST. This involves doing regular fecal egg counts, FECs, on all the horses, usually throughout the grazing season. And what we consistently find is really interesting. Only a small percentage of horses in any given herd, often around 20%, are the high shedders.
Ah, the super spreaders,
Yeah.
basically.
Pretty much. They're the ones shedding the vast majority of the eggs, maybe over 200 or 500 eggs per gram of feces, depending on the threshold used. They're responsible for most of the pasture contamination.
Okay, so you identify the high shedders with the FECs. Then what?
Then you administer anthelmintics only to those high-shedding individuals. The low shedders, who aren't contributing much to the pasture load, might not need deworming nearly as often, or at all, depending on the situation. This drastically reduces the overall drug use, which puts less selection pressure on the worms, and that helps slow down resistance development. It preserves a susceptible worm population called refugia.
That makes a lot of sense. But what about those hidden encysted larvae? The FEC doesn't measure them.
Excellent point. That's why, even with TST focusing on egg shedders during grazing season, it's commonly recommended to treat all horses, usually in the late fall or winter, with a drug effective against encysted stages. Moxidectin is often the choice for this treatment, precisely because it targets those inhibited larvae, reducing that hitting burden before they get a chance to emerge en masse later on. And another crucial piece is doing annual fecal egg count reduction tests, FECRTs.
Okay, what's that?
That's where you do an egg count, deworm the horse with a specific drug, and then do another egg count 10-14 days later to see how well that drug actually reduced the egg output. It tells you if the dewormers you're using are still effective on your specific farm. It's vital for catching resistance early.
So it sounds like it's way more strategic now. It's data-driven, not just guesswork. But it's not just about the drugs, is it? You mentioned pasture management earlier.
Oh, absolutely critical. You cannot deworm your way out of a bad management situation. Anthelmintic treatment is really just an adjunct, a helper to good pasture management. This is fundamental. And the single most effective strategy, manure removal. Picking up manure from pastures, ideally twice a week, drastically reduces the number of infective larvae available for horses to ingest. It breaks the life cycle right there.
Twice a week. That's diligent, but it makes sense if it's that effective. What else on the pasture front?
Well, avoiding overstocking is huge. Fewer horses per acre means less manure concentration, less contamination. Rotating pastures, letting them rest, also helps larvae die off. And grazing pastures with other species, like cattle or sheep, can be beneficial. They act like biological vacuum cleaners for horse parasite larvae, since those larvae can infect them.
Interesting. What about harrowing? Spreading the manure out. I hear conflicting things about that.
Yeah, that's a nuanced one. Harrowing can help reduce larval survival, but only if it's done during hot, dry weather. The sun and drying kills the larvae. If you harrow during wet or cool, damp weather, you're actually doing the opposite. You're just spreading the infective larvae nicely all over the pasture, making it easier for horses to pick them up. So timing is everything with harrowing.
Good tip. Okay, any final advice, maybe about new horses or just general health?
Definitely. New arrivals are a big potential source of introducing parasites, possibly resistant ones. So always quarantine new horses when they arrive. And deworm them, usually with something broad spectrum like moxidectin combined with praziquantel for tapeworms, before letting them mix with your main herd. Perform an FEC after quarantine too. And finally, don't underestimate the power of good nutrition. A well-fed horse with a balanced diet generally has a stronger immune system, and a stronger immune system is better equipped to cope with a certain level of parasite challenge, potentially reducing the severity of disease if they do get exposed.
So wrapping this up, what does this really mean for you listening? This deep dive into cyathostomes, these small, strong hails, it's a powerful reminder, I think. Sometimes the biggest threats, the most dangerous challenges, are the ones we can't easily see. The quiet ones, the hidden ones, the ones that are frankly really clever in their biology. And dealing with them effectively means we have to think critically, we have to adapt our strategies away from old habits, and really get our heads around the hidden mechanisms at play.
Absolutely. It reinforces that effective control today isn't just about grabbing a tube of dewormer off the shelf. It's a holistic approach. It's strategic. It needs to be guided by your veterinarian, combining targeted treatments based on actual data, like FECs and FECRs, with really diligent pasture management. It's about being informed and proactive.
So what other hidden challenges, maybe in your work, your life, your own field, might benefit from that kind of deep dive? Something to think about. We'll leave you with that thought for today.